going to have the speakers staying here for the Q&A immediately following this. I'd like to introduce now Kirsten DeMelo, who was born and raised in the USA. That's great. I actually, when Sylvia and I started studying Kardec, we did a group study with her parents. She has been actively studying Spiritism since her youth. She's currently an active member of the Spirit Society of Baltimore and has given lectures on Spiritism in events all over the country. Professionally, she's a registered nurse with a background in case management, critical care, and utilization management. I introduce to you Kirsten DeMelo.
Good afternoon, everyone. Thank you so much for Dr. Doi and SMA for having me here. I truly feel humbled and honored to have...
Sure, I understand.
Oops, Siri wants to participate in this talk today. I feel very honored to be here today amongst fellow colleagues and humbled, and I promise you today will not be data and statistics for that much. Instead, it'll be more my experience as a nurse for the past 8 years, anecdotally, and a few other research stuff in there as well. I thought it'd be fitting to start out to talk about my personal experience. As stated in my bio, I've been a nurse for about 9 years now, and I chose this particular topic, felt truly led to speak on this, spirituality and addiction, because as of late, primarily the better part of my patient population are addicted. And addiction has varied hues. It can be not only addicted to substances, you could be addicted to sex, you could be addicted to hoarding, to purchasing things. But for the sake of this talk, I wanted to share with you my very first experience as a clinical nurse on the floor in the ICU, and with drug addiction with one of my patients, and how that impacted me and sort of has stayed with me to this day. I remember that day, and there, as probably the physicians and other nurses and clinicians, you know that there are certain circumstances, both in your personal life and in your professional life, that impact you, and that even smells and sounds and taste can sometimes take you back to that moment, and as if you were reliving it again and again. And the quiet in this room reminds me of that very moment when I had received report about a patient in his 20s, found a college student found by a roommate, unconscious and unresponsive. And, you know, when you're receiving report or you're reading a medical document, because I also currently do utilization management, so I review a lot of medical records. And when you're reading a medical record, it's dry, it's impersonal. But when you're reading, you're getting a report, and you go and you see a physical human being, it's so impactful. So I received a report about this young man and how he had been found and how he had managed to get a pain patch, and at that time, in the particular region where I worked out of state, had been already reported that a lot of young people were doing this, where they were taking dilaudid patches, or fentanyl patches rather, and cutting them up and putting them on their tongues to get high. And people were getting high because of that. And for this young man, unfortunately, it turned out fatal for him. Walking into his hospital room in the ICU and hooked up to every which machine and plugged into every outlet in the wall and more IVs than any one nurse could probably deal with, it's silent, it's quiet. At least it seemed that way to me. Because as I entered the room, I saw his mother, and she was speaking to him. And I think in that moment, as a mother myself, and at that time I was a mother, and she was muttering things to him as if I wasn't even in the room, because even looking back now, I think to myself, wow, I don't know I would have had that conversation with my child had anyone else been present. But she said the following: And it may not be as impactful as it was for me in that moment, but I hope you'll get the gist of it. And she turned to him in the most visceral or gut-wrenching way and touched his unresponsive body and was sort of trying to wake him and kept saying, "You can't leave me. I'm not ready. I'm not ready for this. You have to come back." And in that moment, that was such a shock for me to witness such a testimony from this mother, this surreal, private moment that I don't even know if she knew I was there, but I had to remove myself. And Dr. Kind, you were speaking about how we, at least here in the US, as clinicians, were taught to separate that. And so not even wanting to separate myself, but just the sheer shock of that real, raw, vulnerable moment that I experienced alongside a mother that was suffering was beyond my comprehension in that moment at that time. And it's sort of been the backbone of how I view patients who suffer from addiction of many different forms, is that is someone's son, that is someone's daughter. No matter what they've done, no matter how far they've gone, that's still somebody's baby. At one point, he or she was loved by someone. And I keep that in the back of my mind every time I have to deal with an addict that suffers from addiction, this disease. I keep that in the back of my mind as he or she is trying to be manipulative or just trying to work the system. I always envision them like I did that young man after that experience. A mother looking at her child, talking out loud where she went wrong, which she could have done. So it's good for us as clinicians to think that way. This is someone's child, ultimately. And I like something that this Egyptian writer who won the Nobel Prize for Literature in 1988, Naguib Mahfouz, he said, "Nothing records the effects of a sad life so graphically as the human body." And I think any healthcare professional can attest to that, and seeing patients that go through a variety of different illnesses, but specifically substance misuse disorder, substance abuse, addiction. There are many different terms for it, or have been, some of which I'll kind of fly a little bit through. You've heard various times throughout these past 2 days about the World Health Organization, the definition of health and disease being the state of complete physical, mental, social well-being. And also just wanted to make this term a little bit more clear if I use it interchangeably, because even in layman's terms, patients use this interchangeably. So for all of us, it is called substance use disorder, aka addiction, substance abuse. It's defined by the Substance Abuse and Mental Health Services Administration as substance abuse use disorders occur when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. Now called substance use disorder, includes tobacco, opioid hallucinogens, and stimulant use disorders. Addiction as a whole, like I said earlier, can encompass a whole lot of things. But spirituality defined in modern and more applicable terms, I wanted to sort of bring us up to speed with that, because oftentimes spirituality, and I wanted to define both these terms before I kind of jumped in a little bit to more of my talk, was that oftentimes spirituality is automatically, even unconsciously, equated with religion. And it's not necessarily religion, because there are a lot of non-religious people that are very spiritual. And the old belief is that spirituality is religiosity connected to religion. And I liked what the director of George Washington Institute for Spirituality and Health, Dr. Christina Puchalski, she defined spirituality as the aspect of humanity that refers to the way individuals seek and express meaning and purpose, and the way they express their connectedness to the moment, to self, to others, to nature, and to the significant or sacred. I like something that a lecture I saw Hou Teixeira gave quite a long time ago, when he talked about how oftentimes we may live in a city know nothing about it, know nothing of its culture, its background, but that by appreciating or connecting with our spirituality and getting to know the area that we live in, the tree that we have outside our home that's been growing there for 30 years, connecting with nature, being grateful for all around us, that is also, it encompasses spirituality and something for us to think of, especially as we are dealing with our patients. Because when Allan Kardec talked about these universal truths in the gospel according to Spiritism, when he talked about the spreading of Spiritism, he said we should help people to be more spiritual, more than anything else first, to help them just to appreciate what is around them, their connectedness with other things. And another little tidbit I wanted to throw in there as for the clinicians that are listening, for those who are involved with patient care, I found this very interesting article entitled Spirituality, Hardiness, Spirituality, and Suicidal Ideation Among Individuals with Substance Abuse, the Moderating Role of Gender and Marital Status, and it's published in the Journal of Dual Diagnosis. What came out of it was something interesting amongst other things, and I pulled one particular aspect. It said that when assessing the risk of suicide with individuals with substance abuse, it's important to account for the presence of spirituality, hardiness, which is basically defined as attitudes that provide courage, motivation, turning potential disasters into success, in addition to other protective factors. Findings reinforce spirituality and hardness as a protective factors against suicidal ideation with individuals with substance abuse. All in all, basically, is making that assessment, and as multiple other physicians and clinicians have shared here today, making that assessment, gauging your patient to see where they're at, and encouraging this idea of spirituality, maybe not directly, but encouraging them to find positivity, things that are positive around them. I did want to interject something that I found very interesting, and you can find it in this particular book, In the Domains of Mediumship, where they just kind of give several different accounts of spirits that had passed on that were alcoholics, that had smoked cigarettes, and kind of giving a feedback of those spirits and how they were relaying to the incarnates. And on chapter 15, you can read more in depth about it, but basically I just grabbed a little piece that said, some discarnate spirits absorbed mouthfuls of smoke which were exhaled into the air, still warm for the lungs that expulsed it, finding happiness and nourishment in this. Others breathed in vapors of the impenitent alcoholics, and you can go on. Basically, they're trying to illustrate how there is this interchange between the spirit realm and the physical realm. There is that component in our health, physical, mental, emotional health. There is the component of the being, the eternal being that we are, past lives, experiences in our childhood, nature versus nurture, all of that. We are very complex beings, but we cannot ignore the fact there is spiritual influences as well. I'll run briefly through the following, which is 4 major components that Dr. Brené Brown, if you ever had a chance to watch anyone, Google her, she's amazing. She did this amazing research. She's a researcher out of University of Houston, and she found that she wanted to research people that overcame hardships and that were resilient, particularly for women who were experiencing shameful circumstances. And she said she found 4 common threads that were woven into all those that were able to overcome shameful situations such as addiction of varied hues, anything from drug addiction, food addiction. And she found that those women had 4 common things: courage, connection, compassion, and empathy. Most of those words, we know what they mean: courage, compassion, and empathy. But I wanted to touch on connection because it's very interesting that in a book that was recently launched in English by Joana de Angelis, psychographed by the Brazilian medium Givaldo Franco, called Life Challenges, and I forget the little end of the part of the book, but it says that, thank you, she mentions about how there are people that are very spiritual and very religious, but she says that then there are people that are very spiritual and religious, yet they seclude themselves, whether they meditate and they don't go out, they don't connect with other people. And she says that that's not the best way to go around things, to do things. We are social beings. We need this connectedness. And even for addicts, one of the things we do completely opposite is we segregate them, we judge them. The whole the paradigm, how we view them, how society, at least here in the US is what I'm familiar with, we do segregate them in every single which way possible. Whether it's we don't look at them, we don't want to be associated with them, we surely don't view them as if potentially my daughter or son could be in that situation, when in fact we now know that the heroin epidemic in Baltimore and throughout the US, because drugs are everywhere, they're no longer behind alleyways, they are everywhere. So these 4 parts, courage, connection, compassion, empathy, really applies to all of us for us to follow. And just some last things just to cover, some spiritist practices and spiritual practices that we either personally can do or we can share with others. And as Dr. Knoploch had the opportunity to share with her patients, you have to gauge. But some of those things are passes, spiritually magnetized water, bringing them to the Spiritist Center, or encouraging them, as Dr. Lukechi had shared, about going to their own religious to their church, to their synagogue, to encourage them to reconnect with their spirituality, because connecting with the greater good, gratitude for all things, that's something that we can all understand and get independent of our religious affiliation. So I thank you so much for your time.